Welcome, everyone. I can see a few people trickling in from online. Welcome to our CPE speaker series for April. It's the Thursday before a long weekend, and so it's an exciting time to have one of our speaker series for today with Kaitlyn Watson. We're really looking forward to the conversation we're going to have with her. So just briefly, my name is Annalise Mathers. I am a research officer at the Faculty of Pharmacy and also the administrator for the Center for Practice Excellence, which hosts these sessions. I am really delighted to be co-facilitating today with Emily Musing, and I'll just hand it over to Emily to introduce herself.
Great.
Briefly.
So very happy to be here today. My name is Emily Musing, and I'm the faculty's inaugural leader in residence. So as such, I've worked with various members of the faculty to really embed leadership principles and presentations into various parts of the curriculum. And we'll be implementing a one-week leadership intensive coming up last week in August for third-year students. But I also get involved in really fun activities like today. Prior to my recent retirement, I was involved in the implementation of COVID vaccination efforts across the GTA. So today's topic is really close to my heart on behalf of the Center for Practice Excellence. And the topic, as you know, is what the future of pharmacist roles looks like in disasters after coronavirus. So Annalise, back to you.
Yeah, thanks so much, Emily. It's definitely an exciting time, and we are very lucky to have you with us today as well. So I'd just like to start, before we kind of jump into the presentation itself, I just want to start with a land acknowledgement at the beginning of our presentation. So I'd just like to acknowledge the land I'm on today at the University of Toronto. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. For my own path to truth and reconciliation, I've personally benefited as a settler from living on this land here in Treaty 13 in Toronto, as well as throughout my education and training on the land in Ottawa and British Columbia. I'm really grateful to work towards a deeper understanding of the history that's brought myself and all of us here today to reside on this land and to work towards creating environments of mutual respect and learning. So really grateful to be sharing this space with all of you. Like Emily said, our event today is looking at the role and responsibilities of pharmacists in disaster planning and preparedness, a topic that's particularly important as we continue to emerge with many lessons which are still being learned from the COVID-19 pandemic. We're very fortunate to have Kaitlyn Watson as our presenter for today, and she'll be guiding us through her presentation. And then, as usual, we'll leave the last 20 minutes or so for audience question and answer with all of you online. Because it's a small group, I usually say let's keep ourselves muted, but I think if you have questions and comments for Kaitlyn at the end, I think we can just have more of a roundtable setting maybe. So I'll just ask that you maybe use the raise hand function, and then Emily and I can triage that accordingly, just because our group is so small. So I think it lends itself nicely to that. With that being said, I'll pass it back to Emily and she'll introduce Kaitlyn.
So I think you're in for a real treat today. So our speaker is Dr. Kaitlyn Watson. She's an internationally recognized disaster pharmacy researcher and the founder for Disaster Pharmacy Solutions. She wrote the foundational book, Disaster in Emergency Pharmacy, A Guide to Preparation and Management. And Dr. Watson is also a CIHR-funded Health-System Impact Fellow with Hypertension Canada, the EPICORE Center at the University of Alberta, and the Center for Implementation at the Ottawa Hospital Research Institute, focusing on implementation science and primary care. Dr. Watson is an Australian registered pharmacist and a mixed methods researcher, and we're really delighted to have her here today. I'll pass you right on to Kaitlyn.
Thank you so much, Emily and Annalise, for having me. It's an absolute pleasure. So just to start with, I know that we've already done the land acknowledgement, but I just wanted to mention that where I'm from in Edmonton here, that we're on Treaty 6 territory where I'm presenting from. And I'd just like to acknowledge that I am a settler on these lands as a recent immigrant of Canada, but also a settler in my home country of Australia as well, in that sense. So just in terms of the learning outcomes I'm hoping for with this talk, and definitely at the end, happy for that roundtable and discussion, is really around acknowledging the importance of pharmacists in mitigating, preparing, responding and recovering from disasters and emergencies, identifying some of the impacts of COVID-19 pandemic on our pharmacists, which I'm sure you've all know firsthand, as well as discuss some disaster preparedness activities for pharmacists to build a resilient pharmacy workforce. So to start with, importance of pharmacists in disaster and emergency management. So some key statements just to start with. So pharmacists are already on the front lines of responding and recovering from emergencies, but at the moment we do it in quite an ad hoc fashion. So we're very reactive in our approach. We are, as we all know, the most accessible healthcare professional available. We have a duty of care to our patients and our community to provide ongoing access to care during disasters and emergencies. There's a huge expectation on us that I'm sure we're all aware of, having lived through COVID, around that pharmacists will be open, our pharmacies will be open, accessible and ready to respond in emergency. And that comes directly to us as our pharmacists of how we're going to do that. Pharmacy is often the first medical entity to return to operations in a community following an emergency. So looking sort of beyond a pandemic, but a wildfire, a flood, some type of disaster or emergency scenario, pharmacy is usually the first one that's back into operations in a community. So the question becomes, how can we best support pharmacists to fulfill these roles? So it's not a question of if these roles are pharmacist roles, but how can we support them? Because we are already doing it and it's an expectation and a duty of care for us. So this figure I published in my book and it came from my thesis, but what I like to discuss in terms of this is really understanding the disaster management cycle and that it is a cycle. Quite often we talk about these phases of prevention, preparedness, response and recovery, and they make it sound quite linear and that one starts after the other. But what I find is that it's not actually in that approach like it is on the screen. And what it is more accurate is the fact that prevention, prepare and mitigation, which is here in the green, and preparedness, which is in the purple, we should always be doing these roles. We should always be thinking about these things. And I'll touch on what each of these phases mean in a little bit. But it's really important that we don't wait for a disaster to happen and then we start reacting and responding. But what we should be doing is looking at how can we prevent or mitigate the impacts of these types of events on our community, on our healthcare system, and also how can we prepare our workforce as well as our community in terms of a disaster or emergency. So this black cyclone figure is like a symbol of when a disaster occurs in terms of the figure. You'll see the orange is the response phase, and it actually should start before a disaster happens. So where possible, we should be preempting the fact that a disaster is about to impact our community and start putting those plans into motion. So for example, if we look at the COVID-19 pandemic, we saw it starting to happen outside of Canada and outside of our community. So we should have been getting ready and start responding in terms of if that impacts our community. Then if it's not, then it's just a preparedness activity, but that way you're actually ahead of the game. And then recovery at the same time doesn't wait till response finishes. We need to start recovering essentially once the disaster has happened. We need to be thinking about those things, and that sort of comes into the long term, but I'll touch on that in a minute. So if we look at that prevention or that mitigation, both words are used quite interchangeably in this field in terms of the disaster management cycle. So what we mean by this is really preventing refers to taking measures to mitigate the impact of an emergency on our community. So for example, every year we gear up in pharmacy for our influenza vaccination campaigns, and we do this in an effort to prevent an influenza outbreak. So these would all be considered prevention or mitigation strategies. Then if we look at the preparedness phase, this is really just the accumulation of the knowledge, the skills, the abilities, the behaviors, the experiences, beliefs, resources, and professional environment that is required to respond and recover from a disaster event. That's a lot. There's a lot of things that we need to do in the preparedness phase, and this is where we need to concentrate our time, because the more prepared we are, the better we can respond. So one example here is developing and testing emergency plans. So I like to ask the question, what would you do personally to respond? What would you do in terms of childcare? If you weren't rostered to work, would you show up after a disaster event has happened? How will your pharmacy team respond? What would your opening hours look like? What would your operations look like? All these types of different things is when we need to start thinking about this in the preparedness phase. And there's a lot more different roles, and you'll see the reference on the slide. I took an international approach and did a Delphi study where we actually defined with an expert panel as to what the roles of pharmacists would look like for each of these 4 phases. So if you're interested in more of them, I would encourage you to go to that resource. Then when we look at the response phase, what we're looking at doing is putting all of those plans, all of those procedures, everything that we've been preparing for into action. So really we're addressing the short-term needs, the basic human rights that people need access to, and making sure that patients, in terms of the pharmacy, that we really focus on that continuity of care and making sure that people have access to that, whether it's prescribing chronic condition medications, minor ailment prescribing, those different things. Then when we get to the recovery phase, this is all about building back better. So it's not about just building or returning to normal operations. We need to be trying to meet that milestone. So for example, if you had a wooden shack that fell over in a cyclone or a hurricane type event, you're not going to build back another wooden shack. You're actually going to build back something made of perhaps steel that can withstand the next cyclone or hurricane. And the same principle needs to apply to our healthcare system. We survived COVID-19. There was a lot of challenges. So we don't build back or return to our normal operations. We need to improve based off the lessons that we've learned from that experience. Something that I really like to touch on, especially when I'm talking to pharmacists, is self-care. We're not the best at looking after ourselves. We put our patients before us, which is an admirable trait, but we do need to focus on looking after ourselves, especially in these prolonged types of disasters. I like to think of it in terms of the analogy of when you're on an airplane and they go through that safety briefing of if there was a disaster or emergency, they ask you to put on your own oxygen mask before putting on someone else's or helping someone else. The same needs to apply to us as healthcare professionals when we're working in disasters or emergencies. We look after ourselves, we can look after others. Something or two important things that I wanted to touch on is just around documenting the lessons that we've learned, as we say in Australia, or the lessons that we've learned, but really making sure that we learn from COVID-19. So now is the perfect time. We've kind of moved into this recovery phase in terms of societal attitudes to COVID-19, whether or not that's the correct thing to do, but that's sort of where we're at in terms of taking the temperature. So really now is the time to document what were the challenges that you personally faced, that your organization faced, that your pharmacy faced, that your team faced in terms of COVID-19, and what can we learn from that? You know, what do we need to address? What networks or communication or relationships do we need to build? Now is the time we need to look at that, and we need to document and make sure that we know and that it's out there for everyone to see. The other thing is advocating for the seat at the disaster health decision table. We need to make sure that pharmacy is represented on the small local scale, on the provincial scale, on the national scale, on the international scale, when these types of things are happening, because pharmacy is such a huge part of the response. We saw that in COVID. Everyone relied on our pharmacies to keep the healthcare system going. And so we need to make sure that we're a part of those decisions. And again, we're not reacting. So that's sort of, I guess, a little bit of background, but I wanted to touch on some of the work that we've been doing during COVID-19 pandemic, the team and I have been doing. So this was an international scoping review that we did. So we looked at the first year of the COVID-19 pandemic, and we really wanted to find out what were pharmacists doing, what were their roles, what were their different services that they were providing. And this is the conceptual framework model that we came up with. The reference is on the slide if you want more information. But really, what was interesting was that it came down to three different large role category groups. So medication management is, I'll start at the bottom here, is visible at the patient level. This is our interaction with one-on-one type interactions with people that come into our community pharmacies, or pharmacy in general. This is the continuity of care, medication supply, prescribing, the community healthcare hub process, remote services or deliveries, remote monitoring, those types of roles. So that's always been visible at the patient level. But what became interesting in terms of COVID was how more publicly visible that became. Everyone knew that you could turn to your pharmacist for those roles. At the next level, so the blue sphere, is the information roles. So this was visible more at the team level. Typically, you know, our colleagues know that they can come to us for information, our team members, our patients, our community members. And really, we're very good at sharing that information with patients, community members, colleagues, other healthcare professionals, government organizations. But this became way more visible. And it wasn't just people coming to us for chronic disease information, perhaps, but it was public health information. A lot of people were coming to us to distill down the different information that was happening So this was a huge role that became very visible and beyond just medications or just the drugs. Then the last one is the public health. So this is by typically the most visible group because this is at the community society level. But prior to COVID, I don't know how many would give pharmacists credit for being public health people, for being public health pharmacists, where that all changed during COVID. So, you know, we have a duty to keep patients safe. We took a lot of prevention strategies. There was a lot of stories of pharmacists proactively providing public health messaging, providing, you know, PPE supplies to their community, keeping their staff safe in terms of changing some of the way that they do the workflow or doing shifts and delivering medications. Like there were so many changes that happened to address a lot of the public health challenges, as you'd expect with a pandemic. But what was interesting in that last point in that square for the public health was around the emotional and psychological support. People were coming to pharmacists to allay their fears, to share their anxieties, to get help rationalizing and determining the level of risk that they're comfortable with. Pharmacists really became that person for people because they're so accessible and available in their community. And then over on my right, in terms of the COVID-19 foundational context. So in terms of looking at COVID, pharmacists were given a lot of autonomy. They accepted a lot more responsibility. There was a lot of well, if I don't help these people, who will? And so a lot of pharmacists stepped up around the world to really be there for their patients and their community. They felt that they had to honor patients' needs. They really accepted that discomfort of how do we work in the grey? We love our policies, our procedures, our black and white, but with the changing information landscape and how quickly things rapidly changed, we had to get comfortable with working in that. We think this is the way it is, and I'm just going to have to go with it at this point. Share as much evidence, be as open as we can with where we know and what we're at. There's a lot of changes in our different laws across the different governments and jurisdictions to give pharmacists more autonomy and a lot more abilities. So, you know, as we know in Canada with some of the changes to the controlled substances, but there was also changes in other countries around allowing them to do a lot of like, I guess, the refills and kind of the chronic disease prescribing or vaccinations. There was a lot of changes in that space, as I'm sure we're all aware. And we really served patients, but our services to patients were seen on a societal level. A lot of people were coming for a lot of different things, and people that perhaps don't have chronic conditions and aren't regular members of pharmacies were turning to pharmacists, which is really exciting. We were very visible. It's essentially the change of that. So, and then, yeah, this was meant to be before that slide, but a snapshot of the impact of COVID. But another study I wanted to really highlight, and this one has just been published and the reference is on the slide, is we did this photo voice methods. So what this involved was we really wanted to gain, after having done this scoping review of, you know, there's a change in landscape, a lot of the literature is saying there's a new era for pharmacy coming. We're on the precipice of something new. What's it going to look like? So what we really wanted to do was to gain a really deep understanding of frontline pharmacists' lived experience of the COVID-19 pandemic and how it impacted their roles and sort of where are they at, what is this precipice point that we're on? So we looked at this study. It was specific to Alberta community pharmacists, just based off the focus and the reach that we had with the funding. And so we asked participants to provide 3 to 5 photos before the interview that really reflected on how they see themselves as a pharmacist and or represents what they do as a pharmacist. And so we did this at the start of 2021 in terms of when we collected the data. So the pharmacist roles that were made visible during the pandemic. So we used this same conceptual framework model that I just talked on in terms of the 3 pillars of medication management, information, and public health. And so what we found was the roles that this involved. So we conducted interviews with 21 participants, and there were 71 photos that they provided. And what we really found was that in addition to what was made visible with pharmacist information, public health, and medication roles, there was also a lot of invisible things that were made visible by the pandemic for the pharmacy workforce. And one of the big things was around leadership roles. So it's revealed through this very reflective nature of the study how important the leadership role for pharmacists is in our communities. and I'll touch on that in a little bit. But what I wanted to focus on first was the information role. So one of the things that a lot of our participants talked about was how the phone became a symbol of the stress associated with the overwhelming scale of people seeking reliable and trusted information. People sought out their pharmacists to distill and make sense of that conflicting and that wealth of information and misinformation that was available to people, and really came to pharmacists as that trusted, confidential, reliable resource that they could come to find out how to make sense of this. Pharmacists took their role really seriously and their responsibility in terms of information. Their credibility was seen as extremely important. There was some disconnect when all the information was changing. There was rapid changes in policies and different things happening, that pharmacists somewhat struggled with what they said in the morning to patients all of a sudden became irrelevant, or the information had changed. And so their credibility was really important to them. This photo was around a particular participant having news and gossip for breakfast. So she would start every day looking up what was happening in terms of the gossip, in terms of Facebook and different things, and then fact checking everything, because she knew that her day would end up being what was out there and people coming for that information resource. So it was really interesting and a unique insight into the information role. The next one is public health. So this is not a new role for pharmacists, although it kind of seemed to be the way that we've been talking about it with COVID. Pharmacists have always been doing public health roles. We've always been doing vaccination campaigns for different diseases, influenza being the most prominent. But this became really visible to participants and to the community during the pandemic. Obviously, the most visible being the vaccines, which is represented in this photo. And that does correlate with that where the time of when we were doing the interviews, vaccinations were hugely prevalent. But prior to that, obviously, with all the screening and different testing and things that happened, participants felt very unprepared to be on the front line of enforcing the public health policies. I'm not sure how often we've taught what to do in that situation. And as a consequence of that, they wore the brunt of people's emotions and anxieties and fears. And it was never ending. At one point, we were talking to some of the participants, and it was right around the time that most people who wanted a vaccination had got it, but they brought in that policy around to keep your employment, you had to go get vaccinated. So there was a lot of different stories. And if you're interested, there's quite a number of quotes about it in the paper as well that you can go check out. So, but despite all of these challenges, all of these emotions, feeling unprepared, there was a very strong sense of pride and a strong sense of accomplishment for the amazing work that pharmacists were able to achieve in tackling this public health crisis, and how valuable they were and how seen they were during this process. Then in terms of medication management, so the participants really had a strong commitment to spending time with their patients and to focus on the whole person and not just the public health measures that they were trying to enact to combat COVID infection. And they felt very visible and seen for all these different things. There was a bit of discontent feelings for some of the participants when they felt they didn't have enough time in the day to dedicate to these patient-centered medication reviews, care planning, and different things for their patients. And so a lot of these medication management activities started to pile up as other needs were prioritized due to the unrelenting needs of the COVID-19 pandemic. You can see that here in this photo with how many different things were piling up. Yet this role, even despite all of this, remained such a high priority for participants, and they really ensured that patients received at the bare minimum their medications and prescription refills. And I don't think that that can go unacknowledged. That's still a huge role. That's a huge important thing. And pharmacists made sure that maintained it as a minimum, if not working well above that. The increase in the workload for pharmacists was visible to the participants in the piles of prescriptions, as I mentioned. But despite all of this, they felt a really strong sense to do more with the same finite resources. So somehow I have to do all of these public health ones that are in the previous photo, in addition to my medication management, and not feeling the pressure to do both, but not willing to give up those medication management roles because it was so important to them in terms of meeting the patient's needs and providing that continuity of care. And then what was really exciting was we expanded that conceptual framework model to show leadership. in addition to the other three groups in terms of the framework, we couldn't ignore this fourth role of leadership that became really visible as part of this pandemic. The participants realized as they reflected on their lived experiences, how they were definitely in a position of leadership within their community and during the pandemic. And it wasn't necessarily that we only interviewed managers or store owners. These were everyday, there was a variety of different pharmacists, including pharmacy, new pharmacists as well as experienced and in different positions within community pharmacy. They all felt a really strong need to lead by example for their staff, for their colleagues, for their patients, and for their community, especially when it came to the public health measures and their roles of enforcing policies. So if I'm expecting you to do something, I better be doing it myself. And while that was specific to COVID and mask wearing and vaccination and things like that, there was also the other things in terms of healthy eating and weight management and looking after yourself with all the lifestyle factors we constantly counsel about with our patients and chronic conditions. Many of them also described that while they might be the face of community pharmacy, they are supporting an entire team of pharmacy staff behind them. And they felt a responsibility to protect and consider the mental health and the well-being of their staff and colleagues as part of that. So as I mentioned, it wasn't about being a position or a job title, but the action that they carried out. They acted as leaders. It wasn't about the title. They really led by example and being role models, and they really built supportive teams around them and protected the well-being of the team. So something else that was really interesting was the invisible toll that the COVID-19 pandemic took on our participants, being specifically Alberta community pharmacists. So they really reflected during this activity, and it's what I loved about this photo voice methodology that we used for the interviews, was in addition to the roles that they provided and how they were able to be helpful, there was a few different things that came about in terms of their experiences and what they had to face and the challenges. So these were around leadership from the front line, accessibility being a double-edged sword, the adaptability of pharmacists, threat to safety, and the physical toll of being on the front line. So the participants described how they saw really there was no other alternative other than to continually adapting to meet the needs of the public. So one quote reads, "You just kind of do it without thinking. This is what you have to do, and you either do it or you struggle along the way. You don't really have a choice." And that was somewhat of the attitude of all of the participants in the sense that the patients in the community and the team is relying so heavily on them. There is no alternative. You adapt, you make it work. One participant was very articulate in explaining how battered they felt, and yet they still had a feeling of great pride as a pharmacist, which was visible in the photo here of the white lab coat. And the quote reads, "The white coat symbolizes us as a healthcare provider, what we're able to do for our patients. But the reason I kind of left it a little bit grimy, a little bit unfolded, shows the level of work we've had to do to attain that. And even now, throughout COVID, what we've had to do to try and maintain that level of care we provide for patients. It's very time consuming. It's a lot of extra hours, and especially with the shortages, it shows how we as healthcare professionals can be quite battered from all the external stimuli." So I found I couldn't rephrase that. I had to read you the quote because I can't do it justice in terms of what they were sharing. Also, due to enhancing the visibility of pharmacy services, some of the participants felt they had a lot of greater demands placed on them. They had to do all of these different things, as I mentioned before, with the same finite resources that they had available. And so this led to a lot of feelings of being overwhelmed, the plate being too full, which is illustrated here on the slide. And the quote that goes with that reads, "So the workload just increases. Like the plate is full. They want you to make it look like the plate is perfect, like there's nothing on your plate, but the plate keeps getting filled. It just keeps piling up. And then like you didn't get rid of the mess, all of the workload, the prescriptions, the questions. So it just keeps piling up." So interestingly, additionally, some of the participants really expressed the physical toll the pandemic had on their personal health. Some described hair and hearing loss due to the stress of working during the pandemic. And then the black mask here on the screen was around the threat to personal safety. and how every time pharmacists, specifically our Alberta community pharmacists, were interacting with members of the public, there's that threat to their personal safety, and what are they bringing home to their families, to their loved ones, to their vulnerable populations at home as well. So that's kind of just a bit of a snapshot of how COVID has impacted. But I wanted to touch on it and not leave it there. As interesting as that is, and the findings of what can we do now? So we're in this recovery phase. We're trying to think beyond COVID. What do we need to do? So the first things, as I mentioned before, was really building on the lessons that we've learned. So disaster plans are meant to be living, breathing documents. We should be continually testing, drilling, and updating them. So now is the perfect time to dig out and dust off those disaster plans that we may or may not have used during COVID, or that we wrote during COVID, and figure out how it's going to work for the next disaster or the next emergency. Because it's not a matter of if another one's going to hit us, it's just a matter of when, and we need to be prepared. And that's how we build our resilient pharmacy workforce. Two things I encourage with you, if you're going to look at doing that, is taking what we call an all hazard approach. So we don't prepare just for pandemics. We don't prepare just for a fire. But if we take an all hazard approach, a lot of the pharmacist roles are the same regardless of what type of emergency is going to impact us. There'll always be nuances and all special challenges and different things, but for the most part, people still need information, medication management, and for us to be there as leaders. So how can we make sure that they're inbuilt into our plan? As well as it's not just about us on our own, but how can we connect in with the existing systems within our community, within our healthcare, and make sure that we are well supported, as well as we can support others. Something that I always like to touch on is we can't forget about the rest of the pharmacy team. I talk a lot about pharmacists, and I do believe that pharmacists have a strong role to play, especially in terms of leadership. But this is not specific just to pharmacists. We're only as prepared as our staff is. We can't open pharmacies without them. We can't run our pharmacy departments without them. So we need everyone to be prepared to build that resilient pharmacy workforce, and everyone has a role to play. As I mentioned, they include different other staff members, and a lot of times our other pharmacy staff members can backfill different roles. There is something that we can do, everyone can do to contribute. By better utilising the scope of practice and abilities of the whole team, we really increase the healthcare resources that are available to more effectively respond. And we couldn't have done it without them during COVID. So this is something that we do at Disaster Pharmacy Solutions, is we provide a lot of this disaster education and preparedness activities. So we do things like this in terms of the webinars and talks that we do. With my research hat, I do research. But we also provide simulated disaster workshops. So this is a way that you can, if you're feeling daunted by how do I even start with a disaster plan, we provide hypothetical emergency scenarios. They evolve based off your different level of preparedness and resilience and your different response actions. So it helps you find the gap in your plan, as well as your teams, building and leadership activities, and being able to work collectively to enhance your plan for next time. So that's definitely something that we do. So to help fill this gap, we've provided these services quite often. And so one of the things that we've done is we've actually then studied in a pre and post evaluation style when we provide specifically one of these workshops at a conference. So it was a health system conference for pharmacy. And we looked at before and after this workshop exercise, what happened in terms of people's disaster preparedness, willingness to respond and to participate. So what we found was 87.8% believed that the workshop improved their understanding of disaster management activities. Over 90% believed the exercise helped them to identify their strengths as well as any gaps in their understanding of disaster preparedness, response and recovery. And over 90% wanted more learning opportunities, which at the time this study was done prior to COVID-19. And there wasn't a lot of opportunities available for different professional development opportunities. And so now with COVID, that's been one positive that's come out. There's a lot more different opportunities to upskill in this area. So it really shows that there's a good appetite among the pharmacy workforce for these different disaster-focused professional development opportunities. which everyone agreed in terms of the participants that participated, that they would like more of these opportunities to practice their disaster preparedness, response and recovery plans, as well as what roles they would undertake. But I think it's also important to note that this is not just for the pharmacy managers or the people in leadership positions, but this needs to be for everyone across the pharmacy staff. These roles are really important. So some preparedness steps that you can take to leave you on some positive notes was around to review your place at work's disaster plan. Do you know what it is? Do you know where it is? Is it only stored electronically? What happens if there's a power outage? Discuss with your team how you can prepare to respond. Engage in discussions about pharmacists' responsibilities for disaster management and emergency planning. Participate into different education and preparedness activities like this one that you're all a part of. Really reach out to your local disaster committees and get involved. Your community is going to be the one that's going to respond first for your community. So how can you best support the local response as well as them supporting you as well? Also advocate for reviews of pharmacy legislation and funding arrangements to ensure that pharmacists are well supported. I think we've learned in COVID, there was many things that worked well and didn't work well, and how can we perhaps move that forward? And then, as I mentioned previously, we need to start lobbying or continue lobbying for pharmacy representation in disaster health planning and management across the board. So I want to leave you with some self-reflection questions, and maybe this will be a nice way to open up the question and answer time is, what would you do differently based on your experience of the COVID-19 pandemic? If you could do it all over again, what would you do differently? What is your plan for the next pandemic, the next emergency, or a completely different style of disaster? So if there was a fire, a flood, CBRN, which is chemical, biological, radiological, or nuclear disaster, or a power outage, or something else that's going to impact you. How will you voice and advocate for the support needed to fulfill your disaster roles? And the last thought I want to leave you with is every pharmacist is a disaster and public health pharmacist. It's not a subspecialty. Everyone is going to be coming to you, regardless of where your role is, to be responding. If something happens, they look to us to lead in this situation. So how can we best support ourselves to be able to do that and step into that role? So I will hand it back to Emily and Annalise. Thank you so much.
Wow, that was absolutely fantastic. Thank you very much, Kaitlyn. So again, encourage everyone to use the chat to submit questions. Maybe I'll start us off because, I'm so interested in this topic. First, I just want to mention, for those that don't know, Minna Tadros from the faculty also runs a really interesting I'm Pharmacy podcast. And in season 3, it's all about big problems and big solutions. So one of the topics that was actually recorded that I had the pleasure of participating in had to do with the next pandemic, and actually linked to many of these topics that Kaitlyn talked about today. So, really excited. So my question, Kaitlyn, is I noticed when pharmacists were involved in all the different aspects of the pandemic this time around, one of the things that happened was that pharmacists had developed connections or solidified connections that they had, whether it was in the Ministry of Health or public health, or between hospital pharmacists and community pharmacists. Can you speak a little bit about that and how perhaps we can take advantage of those new connections that we have created, or stronger connections for the future?
Absolutely, that's a really good question. Thank you, Emily. Those relationships are so important. It's what you're going to rely on when the next disaster or emergency comes. And I think what's important with that is making sure that we don't forget it. There's a huge appetite at the moment, sort of in this post-COVID kind of attitude of, well, that was a really terrible couple of years, let's forget it, let's move on. But I think the risk of that is if we let that happen, people are going to forget how valuable pharmacy was in responding. They could not have done COVID response without us. Yet if we don't keep knocking out that door, reminding them of how valuable we were, they will forget. You might be invited to be have these relationships, to be at the table for the next year or two, but as memories fade, they're like, oh, we don't really need pharmacy, don't worry, we'll just call you next time we need you. And that's what's happened after previous disaster events. And the challenge with that is we then repeat this cycle of, we get tapped in the middle of the response. Everyone's reacting. It's not necessarily the best way. for pharmacy to respond, and we're being dictated to as to how we need to be involved, as opposed to being there from the beginning. So I think I would encourage everyone who has those kind of relationships, who's able to do those things, build them now, keep them strong, and keep reminding people of why we deserve the seat at the table.
Great, thanks. Annalise.
Yeah, thanks so much for that comment, Kaitlyn, and just for your whole presentation. I think it's so relevant, and it's really interesting because I'm actually a public health professional. That's my background. So that's sort of how I come to the table often. And I feel like in a lot of my education and training, there was this huge emphasis on pharmacy adjacent topics. So like access to medicines, having an essential medicine list for global, governance and that sort of thing, emergency planning, like drug procurement. And I think what really stands out to me is having pharmacy more at the forefront, where it's not adjacent, but it's actually a central presence in the public health and global health response, especially in things like Doctors Without Borders. And like you said, also at very local levels where your community pharmacist is perhaps on, the advisory committee for these sorts of conversations. So I really appreciated your comments around advocating for a seat at the table, regardless of what pharmacy space you're in. And I guess I'm curious just to hear a little bit more about your experiences. I was astounded by the amount of work you've published, like the amount of citations in your slides, totally incredible. And just curious to hear your experience, probably being tapped a lot more for this, being an expert in this field over the past few years. And I guess what some of your strategies are, both to build capacity within your own networks, but then, like you said, just to have this infiltrate more and more of these conversations.
Yeah, it's a really, really good point. And I love your background and perspective. It brings a unique perspective to pharmacy that not everyone has. So I very much value that. I think what's interesting is when I first started this work, back when I started my PhD in area in this in Australia, it was not talked about. I actually fell into this topic when I tried to actually volunteer as a pharmacist in disasters and emergencies, and got found, I was told, oh, we don't need you, pharmacists aren't useful. And so maybe it's a little self-serving in terms of I went to prove the point doing a PhD of, are we useful? Found out the answer was yes, and then how does that look? And so I found that we had to start occupying this space. There was it's such a vacant space. We're so important, but no one had put the pieces together, like you're talking about. There were several different, public health or disaster and emergency conferences that I went to, and I was the only pharmacist. And then, you're doing networking and you're speaking to people, and they're like, why are you here? I don't really understand. And then you start explaining, and, there would be search and rescue people or personnel. And I'd start explaining, well, when you go and door knock and you're trying to evacuate people from their houses, have you thought about their medications? What about the floods of volunteers that are, pulling into this place? What if they forget their medications? And these different things. And as I began to start these conversations, people could really understand it, but just no one had put those pieces together. And so I think we need to, as pharmacists, Emily, you touched on the point before, around our unique personalities, seem to be a collective of our pharmacy culture, is not apologizing for occupying that space. I have a lot to offer in this space in terms of any of you who are working in this space, in terms of responding. We couldn't have done it without us. Don't apologize for wanting that seat at the table. Don't apologize for wanting to occupy that space and to keep it. You deserve to be there. Your input is valuable. So take it, own it. We couldn't do it without you. And I think that's something that's changed in my attitude in this space. Is I was kind of at the very beginning was like, oh, maybe we can try pharmacy. Hi, I'm over here. And then now it's like, no, we've got the literature, we've got the evidence, we know that we belong. The pandemic has helped make that very visible. Take it, own it. We deserve to be there.
So Kaitlyn, I see in the chat, Anne Resnick has a statement and question. She said, I observe pharmacy teams stepping up for each other, i.e. going beyond the normal retail competitiveness or a business approach. And the question is, how can we recognize, nurture, and sustain this attitude for the benefit not only of ourselves, but for our patients and the public?
That's such a good question, Anne, and thank you for raising it. It's a challenging one because we do in pharmacy, especially if we're looking at community pharmacy, wear many different hats, and one of them is business owners. And we can't ignore that. That's a part of it. But we also are healthcare professionals. And what I find is really unique in terms of disasters and emergencies is we tend to step up. We step up, we work together, we figure out the best way to do it, and we'll figure it out later. What I would encourage is maybe having those conversations now. On the tail end of COVID, putting those maybe like a local coalition together in terms of the different pharmacies in your community and going, okay, well, what are we going to do? If a disaster happens and my business is impacted, how can I help you provide things? Or how can we have, shared resources in terms of supply, or if something happens, sharing dispensing histories or going and working in a different pharmacy, and really just figuring that out now and having some frank conversations, as opposed to in the middle of a disaster being like, I really struggled, I couldn't respond, I didn't have stock for this, patient really needed it, and the pharmacy down the street had plenty, but they just didn't know because we hadn't built that relationship. So I would start that now, but that's a really good point to raise. Thanks, Anne.
Yeah, that's fantastic. Does anyone else online have a question for Kaitlyn? If so, please just raise your hand and then we know to call on you. Because I think Emily and I probably still have a list of questions ourselves, but we just want to make sure we're giving other people some space. Okay, I'll give people another minute to think on it. Kaitlyn, maybe I'll follow up and just ask, because I work in research and so I'm a bit of a nerd about those things. If you could just kind of walk us through how you landed on the photo voice methodology and choosing that to illustrate pharmacist stories during and kind of post-pandemic. I think it's such a powerful tool. I've seen it used a lot more in the public health space before. And I think even some of the images that you walked us through on your slides, it told me so much, and I think definitely encouraged me to read the paper as well, but just how powerful an image is in conveying some of those stories.
Oh, absolutely. I love qualitative research. As you mentioned in my intro, I mix methods. I like both. Numbers tell a story, but I feel without the stories to go with the numbers, I feel it's a complete picture. So I really like qualitative research. Photo voice was the first time for all of our team members in terms of this activity. And I definitely cannot take credit. It was one of our other team members that brought it to the table and suggested it as perhaps a great way for people to reflect on their experiences and then to be able to provide that. And having done one, it's amazing. The interviews were so rich in data that we couldn't actually present them all in one paper. We still have about 2 or 3 different studies that we're going to go back to that data and publish them because we couldn't fit it in. The interviews went for about an hour with all the different questions, and there was so much raw emotions that also came out of it. People started sharing photos, and all the photos are available, de-identified as part of the paper in the supplementary material. And there's way more in the paper. But just being, they would start talking, and as pharmacists, we're very, as healthcare providers, we can sort of be objective and we can sort of share things clinically and sort of with that, logical mind. And they would start doing that, but then the photo would invoke some form of emotion or a memory, or when they took it, and just being able to share that humility and sort of that place of vulnerability was really an honor as a researcher. But also just how to enrich the data. So yeah, I really enjoyed photo voice, and I hope to do a lot more of it.
Yeah, thanks so much for sharing that. I think that's one of the things I love the most about these sessions is just getting to see different examples of what's going on in the pharmacy space. And I can imagine just there'll be continued huge uptake with that paper and the other ones coming. Emily, do you have another question?
Sure. I have lots of questions. It's totally fascinating, Kaitlyn. I mean, one of the things that I think pharmacists, especially community pharmacists, had to deal with was being essential workers. They were hit in a much different way than many other individuals who were able to, let's say, work from home. Community pharmacists especially couldn't just say, I'm not going to go to work today. So, I think pharmacists were faced with a very different reality than some people people who were able to, protect themselves from potential exposure. Can you speak a little bit to that and to the concept of burnout in general for pharmacists and pharmacy teams?
Absolutely. Burnout is nothing to sneeze at. Like, it was a huge issue. We already sort of had somewhat staff shortages, and then it kind of just added another layer. Something that I think is interesting in terms of specifically the pandemic in the pharmacy workforce is I'm not sure how many people consciously realized that pharmacists were essential workers. So I think that comes back to the first point, and actually there's anecdotal stories of previous disasters where, non-essential workers are told to go home and, stay home, don't come to work, blah, blah, blah. And pharmacy doesn't stay. They go home because they were encouraged to it. Pharmacists weren't at the forefront of essential services. And that was even at the start of COVID in Canada. Pharmacists weren't on the list of essential services to get the vaccine at the very beginning. And yet they are seeing every member of the community, vulnerable patients, and all sorts of different things. And yet they weren't on that list. And yet they didn't get the luxury of closing their doors, figuring out how to respond and reopening. They had to do it on the fly. So my hat off to anyone that was working during COVID in terms of the pharmacy workforce, because that's huge. You're grappling with the fact that you might not have consciously thought you're an essential service. You've been thrown into this position. You're being told to enforce public health like policies and procedures, being told on one hand, we couldn't do it without you, you're our frontline heroes. On the other hand, you're not really an essential healthcare worker. Like, there was a lot to navigate in terms of those early beginnings. And so, yeah, it's a challenging space. And I hope that we can learn from this and realize that, one, let's all agree pharmacists are an essential service, and make sure that they're supported to do so as well. And there's a lot of great research being done in the burnout space. I couldn't do it justice. It's not my area, but yeah, definitely a huge factor.
Yeah, those are really good points. I think the other thing that I want to touch on is, anytime we're faced with a challenge like this, we do things differently simply because we have to. And the most obvious thing is the increase in delivery services versus having people coming into the pharmacy. Can you speak to any insights that you've gained? Or I would challenge the people in the audience too to share things that you've seen happening through the pandemic that's been different from the past, and that perhaps we should make sure we don't lose track of and don't lose doing in the future. But Kaitlyn, please start.
Yeah, that's a really great point, Emily. And anyone that's in the audience, please share from your experience. I think there's been a lot of positives in terms of different ways that we can perhaps look at delivery options and things like that from previous events. There's stories in the news around, there's a snowstorm, and so pharmacists were delivering medications on snowmobiles, and in my home country of Australia with the floods, and delivering medications on tinnies or boats around. And so I think there's a lot of different ways and unique collaborations that come out of those things, but sometimes they need to be thought about beforehand. Staff safety is a huge aspect, but there's different ways of doing that. There's stories of power outages, and so pharmacies can't operate, so it's not safe for people to come into them. So pharmacists were meeting them at the door or working in the parking lot in terms of the interface with the community and patients, and then keeping those areas safe. So there's a lot of things to consider and a lot of different ways to tackle that, but I 100% agree, we need to document them. We need to make sure that they're known, and then let's use them as the framework for learning and building back better next time.
Yeah, thanks for that, Kaitlyn. And I think along that same vein, Anne just had a comment in the chat about pharmacists growing more comfortable being challenged, whether it's by their patients, the general public coming into the pharmacy, or other health professionals, like that information bucket you showed in your slide. And she says, I hope we're thinking about how we can build on that new strength. And I think resilience and leadership capacity, as you mentioned. And then she also says, I include how to say no, which might be uncomfortable for a lot of us.
Absolutely. Yes. I agree.
Yeah, and I think, sorry, Emily, go ahead.
Kaitlyn, I was going to say the other thing I can think about with regards to unique roles within pharmacy is because pharmacists and pharmacy teams are involved with so many direct interactions with different patient populations. I mean, when it came to COVID, we came to the realization just how vulnerable individuals who are in the elderly population in long-term care facilities were, and how unprepared that those environments were for something like this. What do you think, or could you speak to the role of pharmacists in helping to identify the next pandemic or the next emergency? Where are the real vulnerabilities within the patient populations, and what might be their specific needs that maybe we can play a role in?
Well, that's such a good question. And absolutely, I think we sometimes, because it's a part of our everyday practice, it's, you know, what we've been raised on. I think we sometimes forget the wealth of knowledge that we have at our fingertips with our client database, with our community that we've built around us, with the people that come in to see us. So I think, you know, even just starting there, we know that there's specific medications that are going to impact people's ability to regulate heat in a heat wave. Yet I don't know how many people or pharmacists are proactive about when, you know, a patient's refilling that medication or it's heat wave season and it's coming. Are we letting people know that they're at an increased risk and drink more water and different things that they could perhaps do? So there's a lot of information we have, but I think we haven't recognized how valuable our role is in terms of public health and disaster preparedness in our communities, and making sure people are aware of their risk. Do they have a reserve of their medications? You know, if they had to shelter in place for, you know, 3 days, both medication wise, but as well as otherwise in terms of food and water and shelter and the different things that you need. You know, there's a lot we could do in this space. So yeah, definitely.
I think the other thing I was just going to mention as a topic is the whole concept of vaccine hesitancy, and the, you know, the misunderstandings with regards to human rights versus, you know, public health when it comes to vaccinations. I mean, I know that everyone else here knows that there are many things that we thought were basically eradicated that are coming back around the world because of lack of vaccinations or concerns about vaccinations. Perhaps can you speak a bit to that and the role of pharmacists, not just linked to COVID, but vaccinations in general?
Yeah, definitely. I think we have a huge role to play. And especially in COVID, I mean, you'll see it in the paper, as well as there were so many stories shared of challenges and emotions and fears, and being, you know, asked to just provide the paperwork without the vaccine, and unethical behaviors, and being sworn out, and clipboards being thrown at people, and people just crying on the floor thinking that you're about to kill them when you inject them with a vaccine. Like that, we can't deny those emotions or explain that they're not real, because they're real for those people. But I think something that we can do is provide reliable information. And I think that's what's really been highlighted in some of the work we've done in our team, is how valuable people are coming to us. They're not necessarily vaccine hesitant. They're vaccine hesitant. They're not necessarily anti-vaxxers. They just want someone to tell them they're making the right decision. Or there's so much information out there, I don't even know where to turn. Like Dr. Google is like all over the place. So I think recognizing that people are coming to us for that, and that they're not necessarily questioning. There's one of the quotes in the paper. It's not necessarily that people are coming and questioning or claiming to be anti-vaxxers. They just want some information from you. And I think we have a huge role to play in that, into stepping into those sometimes challenging conversations and being frank with people and being open about the risks and being transparent. And I think sometimes we label before understanding. And I think we need to do some work in that space for all different types of vaccines and vulnerable populations and things like that as well.
Thank you so much, Kaitlyn. I think that's actually a perfect place to kind of bring us to a close for today, because that's an essential need, that, you know, the role of the pharmacist in being able to be an information provider and information expert on these sorts of things will never change, and hopefully just adds to having that long-standing seat at the table. Thank you so much for joining us today. I know we had a small group, but I'm really pleased. I think everyone stayed on the whole session, which just says so much about you and your presentation. We will look forward to sharing the recording from this, and then also I think linking to some of the resources and papers you provided, because I know I'll be taking a look at them.
Yeah, for sure. Thank you so much, Kaitlyn. Thank you for everyone else for joining us. I think this was yet another fantastic topic within this series. And to encourage everyone, if you have feedback, please let us know. And also if you have ideas for future leaders to speak or topics, we're also interested in that as well. But Kaitlyn, thank you. Thank you.
Thank you so much for having me. I really appreciate it.
Okay. Take care, everyone. Thank you so much.